welcome.
I'm not cracking my knuckles. That's actually one of the machines that's ticking here. But if you could explain to the viewers, what is a PEMF machine and how does it work? And also thank you to Colleen, who is actually going to be receiving a treatment.
She's actually undergoing active treatment right now. That's the sound that you hear. So as Ty mentioned, PEMF is Pulsed Electromagnetic Field Therapy. The therapy is not new. It was actually first described by Tesla in the 1880s and 1890s. If you consider that malignant cells and also damaged tissue run at a lot lower voltage or electrical potential, this therapy is designed to up the potential or increase the energy of the cells. So it makes the cancer unhappy. Okay. In addition, here at Center for New Medicine, when patients have the IV therapies or the hyperbaric oxygen, it helps drive those therapies and those nutrients to the affected area. So we can see with Colleen here, we've placed the loop, which is one of the attachments, right over her affected area. So we'll run that for 10 minutes. And then we'll also run the mat, which she's currently lying on, the blue mat here, for 10 minutes to help the electrical potential of all of the cells in her body.
So this is actually pulsing good electricity or good frequencies. Is that what it is through the body?
It is. You know, we hear a lot about EMF, and we know the dangers of the very high frequency EMF. The very low frequency is actually beneficial. It's similar to the Earth's magnetic poles, which are actually we're losing the effect of.
And that's why is that one of the reasons? Let me ask the question because I don't know. Is that one of the reasons why you hear about people that are earthing is so good because their feet are touching the earth and they're getting those frequencies?
Correct. Earthing or grounding is actually being able to be in touch with the earth as the human civilization has been for all the time, most of existence, and now we wear shoes, so we're immune to that throughout the day.
Right. And you also mentioned earlier that your father invented a couple machines that are over here behind me. Can you describe them?
That's true. We use those as well in our big regime here for cancer therapy. There's the Bales photonic stimulator. It is designed to increase blood circulation to the area. So once again, when we have a soft tissue type cancer and the patient has undergone the IV therapy, the hyperbaric oxygen, or even the SOT or low dose chemo, we can focus those therapies to the specific area by vasodilating or opening up the blood vessels. So it's a great way to kind of focus. A little bit of a joke, we say when patients undergo the therapy, they probably don't need it in their big toe. They need it in the affected tumor site.
Right.
So all the therapies here are painless, and we see each patient every day that they have the IVs.
Hi, this is Ty Bollinger. Thanks for watching. If you want to know the truth about cancer, click the link in the description below to watch our award-winning docuseries, The Truth About Cancer, A Global Quest.